Hi, Dr. Bianca. Thank you for being
Hi,
with us.
I'm so happy to be here. Thank you for having me.
Thank you too. So, guys, this is our second mini interview for this year's International Women's Day celebration. This is a special year, of course, and special International Women's Day because the theme of this year's Women's Day celebration is about women leadership in COVID-19 world. And when we heard about the theme, I thought what could the best way to celebrate this would be talking to five incredible women from different walks of life who can help us understand how they dealt with the pandemic and what their key learnings were from the challenges that they faced in the last since the last year, I would say. And today we have with us a very special guest, Dr. Bianca Islam. And I would say she's a superhero, healthcare superhero. And she is a physician scientist from Case Western Reserve University, Cleveland. And you're from Ohio, right? So you live
Yeah,
in Cleveland.
exactly. Yeah, so right now I'm training in Ohio as an internal medicine, physician.
Great. And she, along with her other colleagues, some of whom I've shared information about on Instagram, have been fighting the pandemic on the front line since what? Since Feb 2020, so more than a year now.
Yeah.
So thanks a lot. First of all, thanks a lot for this service. For this, we of course we are not in the US, but I'm sure you've helped millions of people by now probably to and have helped them, protected them. So thanks for that. Thanks for being our healthcare superhero. And we have just a few questions for you. And the first question is, how did you deal with this? How did you deal with COVID-19 or this pandemic? How did this affect you personally and professionally?
Yeah, that's such a great question, Sindhu. But before I start, I really just want to say thank you, thank you for having me as a guest. Now more than ever, it's Women's History Month, International Women's Day is coming up, and I'm so inspired by everything that you do and your mission and your goal. It's very inspiring to have and know a woman who's like owning and running her own business and doing it for an amazing cause to help our environment right now. So thank you for everything that you do. Okay, so I think the pandemic, the COVID pandemic, we know that has affected several millions of people's lives, billions of people's lives across the globe. So I can speak on behalf how my experience has been in the US, but I have family in Haiti and a family in Bangladesh, and I know that they're significantly have been affected over the past year as well. So on a work level, because I'm a physician, I work in an intensive care unit. I also work in the regular hospital wards and also just in clinic. And I think the most thing that has affected me has been the disproportionate numbers of minority patients, so people who are Black and Brown and Latino, Latinx that have gotten COVID. A lot of that is, due to the fact that they have comorbidities such as like high blood pressure, high cholesterol, heart disease. So this is a common issue that's been long standing in the US that we're trying to kind of resolve by increasing awareness of these diseases. But because all those diseases, diabetes as well, kind of increase your risk factor for getting COVID, we see those same disenfranchised populations get affected. And so for me, when I see my patients, when they see me as a Black and Brown person, it really just kind of brings a spark in their eyes to see that someone that looks like them is caring for them. So that's been really like special to me at work. On a very personal level, a lot of these patients, they look like me, they look like my families. And, one of the things I realized is like COVID affects everyone. In the beginning, we were thinking it's a lot of older populations, anyone that has cancers at increased risk, but really also young people. Young people can get affected. I've had patients that were in their early 20s that have passed away from really terrible infection in the intensive care unit. And, as a physician, before we were blessed to have this vaccine, every day we're going in and we are like risking our lives to try to take care of all these, patients. And then we have to come home to our own families who are unvaccinated, children and husbands and wives and elderly patients. So that has been very challenging for us, but we've made it through. We're optimistic. And I think, you know, I'm working in the hospital every day. And at least for now, because patients, people are wearing masks, and I'm actually, you know, we're fortunate to see some of those numbers decrease over time. So definitely mask up, get the vaccine if you can, 100% in support of it.
Thank you so much. I mean, I get emotional when I hear, I'm getting goosebumps actually, to be honest. So, but thank you so much for sharing this, something that's so important for today's day actually. Today is 1st of March. It's Zero Discrimination Day. I don't know if it's celebrated. I'm sure it's celebrated worldwide. And the point you made about how people of different color, different geographies, come, whether they're patient, whether they come in for COVID or for anything, and them feeling secured because they see someone like you there. Itself talks a lot about the kind of world we are living in. So on one end, it's great that they that someone like you stationed there who can make them feel how do you say?
Honestly, make them feel safe.
Yes, but at the same time, they should also feel safe with someone else, who doesn't look like them.
Exactly.
And that is something we all should stand up for.
Mm-hmm. You know, one of the things, kind of speaking about what we're talking about, as we were trying to prepare to create the COVID vaccine, in order to create a vaccine, you have to do clinical trials. And it was a worldwide effort, from the UK to the US to South America, Italy, all these different countries, right? And so when you're trying to create a vaccine that is able to go worldwide, a lot of the countries that have the power to create clinical trials don't reflect the patient population, that they're going to be used on. And similarly, when you do clinical trials, it's you propose it to a patient and they also have to agree to be in it. And so historically, when we look at clinical trials and who's mainly been in it, it's usually like white, older males, which is not reflective of, women, not reflective of myriad of races that are affected. And so ultimately, a big challenge that we've tried to address, in the US is enrolling minority patients into clinical trials, because it's hugely important, if we want to see and make generalizations based off where this medicine or this treatment's going to work. And so, one way is to kind of educate physicians and the medical research team and the scientists on how to understand past trauma, past history of clinical trials in those different communities and why they may be apprehensive to actually getting or being enrolled in a trial. And so that's been one of the great aspects of this year. It's brought a lot of attention that, we need more people from different walks of life in these trials. And one of the only ways is to go out in those communities, educate them and talk about it, so we can be more representative. So, with the pandemic, it's been pretty terrible, but we've also as a nation and as a world has learned a lot of new things on how to, make this world a better place.
No, absolutely. Yeah. And, that brings in an angle of hope, right? Like you keep, when you watch the news, I don't know if you feel this as well, doctor, when I watch CNN or any of these news channels, you just see the negative part of it, and when you speak to someone who's really doing the work on ground, okay, the world is not falling apart. We have great people like, you and of course your colleagues, and you're holding fort and you're like, okay, no, don't worry. It's getting better. Wear masks and, do things, and things will, there's an optimistic side to what's happening as well. As you said, we all have learned something or the other from the past year. And I hope that we can really apply it in the coming months, but let's say for the coming years as well.
Yeah.
Thank you for sharing that. And the second question I think is so relevant for you specifically. And I'm curious to know, because this is something very close to me, and that's why I started Fifth Origins as well. During the pandemic, of course, we all have had our moments of highs and lows, and but we've had an opportunity also to help the community in some way. And I wanted to know from you, how have you, apart from being, of course, present in your clinics and in the hospital, can you think of one situation where you have helped someone or helped a community to, to come out of this, come out of this, the trauma that they've gone through during the pandemic?
Yeah, there's so many things as a physician that I have the chance of doing to help people in general, like coming out of this pandemic. So some of the things at the forefront of my mind has just been like during my clinic appointments, actually recognizing and talking about how hard it is to stay home, right? Because people, we're able bodies. If we're fortunate, we go out, we work, and now like our entire lives have been switched where we're now looking at each other on Zoom, which I might add is an amazing opportunity to meet more people. It gives us that chance. But we're not as active as we are. We're at home. We don't get to see our friends and families, our coworkers. So oftentimes it actually, people can get depressed, like they can get sad, and putting those emotions and speaking them into existence helps me as a provider understand what challenges my patients are going through, and what are kind of things that we can change in our daily lives to improve that. So I think that's been really important for me to help people, and I do this even with my friends. I don't have this experience of staying home because I'm always in the hospital, so I've been very fortunate that like I'm not like just very idle and I don't know what it feels like, but I know that it is definitely challenging. Another thing that I've done to help people, as we're trying to roll out the vaccines to everyone, it is very challenging. We're trying to get it to mass amounts of people, but a lot of the people that we're trying to target are older patients. And in order to recruit them, they have to have cell phones to sign up, and they don't have cell phones. So one of the things that we've done, we've been able actually to help assist with them getting the vaccine, like logging on to websites to help them get it, scheduling their appointments. These are things that they wouldn't be able to do on their own. Several people in our community have now volunteered to actually administer the vaccine. And so obviously these are medical professionals, but in our spare time when we're not working, we volunteer to, deliver the vaccine so we can get more people, because there's not a shortage of people to receive the vaccine, but there's sometimes a shortage of people to actually give it. And I think one of the most special things that I had the opportunity to work in collaboration with you is to actually give our patients masks that they can wash at home and reuse on multiple occasions. So when people come to the hospital, they're offered a mask, like a surgical mask that's one-time use. And oftentimes that's the only mask that they have available to them. So you'll see people save that mask for weeks, 2 weeks, 3 weeks, just to have some sort of protection. But ultimately, that's not the best situation and optimal situation for them. And so to have a mask that you can wash at home and reuse is a really special thing. So we were able to give our patients those masks, and each one of them, when they, when you go to your physician, you go to the doctor, you're talking about everything, and then they're like, oh, here's a mask, a gift. And it's so special. So like they always light up and their eyes twinkle, and they're saying, really thank you for offering this to us. So even those little things like make a difference during this time as well. So we thank you for helping donate all these hundreds of masks to our patients, and we're still giving it to them. So those are kind of the things that I've been able to do because my time's so limited. A lot of it's, centered on patient care. But yeah, those are some of the awesome things.
You're putting me to shame now when you say, yeah, those are the only things I have been able to do. So no, please, it's great. And because you're doing already so much, so I was curious to know, what extra did you think you have done? And yeah, of course, I knew that you would come up with multiple answers, which you have. So thanks for that. And I think, we would not even imagine, right? Like, even like today morning when I spoke to my parents, and they're like, yeah, we were sitting on the internet for an hour to register us. And I was like, oh wow, I would have never imagined that even this is a challenge. This is also a bottleneck for many people to even get vaccinated. Forget about having the vaccines and having people to administer it, but how do you get people to register for it? That itself,
Yeah.
yeah, it's amazing. No, thanks. Yeah, go on.
You know what was, I mean, we think about all these things, all different things every day. And for me, something that I hadn't realized until I came across your company was that now that everyone's using all these surgical masks, when we get rid of them, we throw them in the trash and then they don't cut the ear loops. We don't recognize how that's polluting our environment and affecting our aqua and marine life. And that was, it's something that we know, we've seen, that's why people with the soda can tops, like you try to cut them. And then you realize like, this is a new problem that can arise that's not at the forefront of our minds. And, reusable masks are not only important just for people to save money, to have access to one, but it's also to better our environment. And I think that's a really, really important cause. A lot of people don't think about that when they're using the mask frequently. So I think that's hugely important. And what you're doing, like that's why that is.
No, thanks. No, absolutely. Actually, I read somewhere one of the articles where they said that we actually are going back to where we began before the pandemic in terms of the pollution. Pollution that we have done, like for the aqua, like for the in the oceans, and of course the landfills and the marine life, of course. So yeah, it's a shame, but sometimes you're like, okay, what are we going to do? Are we going to fight this, or are you going to fight that? And I think people have to make choices. And I completely agree that, that was the only reason why I also introduced this product. Because when I delivered during the peak of the pandemic and I had to go to the hospitals because I had some post-delivery issues, I didn't have a mask, so I used the surgical mask. First of all, they didn't work well, and then they used to hurt a lot because of the elastic. And I was like, okay, every time I had to throw it. And somehow I didn't even, now that you're telling me, oh yeah, I remember I didn't even cut the ear loops, and I would just throw it in my bin. But I have no idea where they landed up, or it's going to be recycled, or what's going to happen. And I said, okay, this cannot be sustainable. Like I cannot use it, and my family cannot use these masks any longer. So I said, okay, I'm going to start. And actually, there was a huge, there was a lot of research done on which fabric to use and the thread counts and etc to make sure. And we referred to a paper that was published, I think in March by 3 professors, one of them from one of these big universities, and we reached out to them to ask them more questions. So it was not like, okay, I want to launch it. So we did a lot of research before launching it, that the thread count was as what was mentioned in the paper, and which said it protected almost 99.9%, like exactly as the surgical mask, 5,000 nanometer, the COVID particles and all that. So we did some research, and we said, okay, what, at some point you have to stop the research and put the product out there.
That's just amazing. I'm so glad to hear that you guys used actual data and contacted people. The scientist in me just loves that,
My husband is a scientist. That's why he would never let me do something. So he was the one who, read up everything. And he, of course, for me, 5,000 nanometer. I'm like, what is that?
Well, we're happy and fortunate for the both of you, for sure.
I guess. So so it was. So I keep telling people that it's not that we just launched because it's the in thing to do, that many people have done it, many fashion brands have done it, but it was not that, and that's why we said, okay, we're going to donate for each pack. We're going to donate a mask to someone in need. So thank you for the opportunity. And we've been fortunate enough because we donated we have donated masks to elderly home in India, to a school of around 300 kids. So it has been a great journey to understand why this was important, launching this product, and how it could how it has helped now, especially when people like you who mentioned this, that hey, this was really good. It also feels great, that it all comes in a, I believe that it's all it's circular, right? Like what you start has to at some point come to an end in terms of your thought process. So now it feels like it shaped well. It's
no, definitely it has.
So
Thank you.
thanks for that. And Bianca, Dr. Bianca, just last question for you. We all have learned a lot from what has happened in the last few months, or let's say a year now. And what would you say are your key learnings? Let's say three key learnings from this that we all could also learn from.
Right. Okay. So there's so many things that I can come to my mind that I've learned, and the first thing that really is important to me is cancer. Okay. So for my PhD and furthermore in my research, I studied colorectal cancer prevention. I'm a huge advocate for patients that are suffering from cancer. And I know that that's on a continuum, whether it is from people when you get first diagnosed, and if you survive, we look at survivorship. One of the biggest and devastating things that's come to my attention during this pandemic is that a lot of my patients are fearing coming to the hospital to get their regular screening, right? So we've made so much advancements in women's health, doing mammography for breast cancer screening, for colorectal cancer. We've, made amazing feats through colonoscopy to help prevent people getting cancer. And it's been a year now where patients are just not wanting to come to the hospital. They're scared of contracting COVID. And so, what we're going to see is several people coming with later stage cancers that we could have possibly caught sooner and earlier. So this burdens the individual. It can affect their survivorship, their quality of life. And it was estimated, at least in the US, that we're going to expect to see greater than 10,000 more deaths this year just because people have not been able to get their screening. These numbers could be underestimated, in certain areas who are already limited in their access to getting screening. And so this will extend beyond the US. This is a global issue because everyone is dealing with this. And I think that as we're trying to, like you said, as we're trying to address the current issue of the pandemic, there's all these other things that are happening, like the environment's, getting affected. And now cancer the numbers of cancer that's going to be affecting people can increase. And so while we're dealing with this issue, there's so many other issues that are arising that we're going to have to be on top and trying to address. So if it's one thing that I can try to tell my patients and everyone across the world is that we are making a lot of progress. The hospitals are aware how to keep you safe, wear masks, your staff is wearing masks, and it's okay to come in to get your cancer screening. So that is hugely important. Obviously, another huge important thing that's happening is children, education. So, my mom is a teacher, and she's a wonderful educator that helped get me to where I am today. And while we're able to communicate on Zoom, the teachers have really tried hard to try to continue educating their students. They've been using new techniques like YouTube and learning things out of their comfort zone. But one of the things that we don't realize is a lot of children, they go to school just to get a meal. They don't have access to good food at home, or just don't have access at all to it. And so these same children, they're not able to go to school, not able to be in a safe environment, and they're lacking their breakfast and lunch that they would normally get. And so we have to think about that, how those children are getting affected mentally. And, from grade school all the way up to high school, we know that social interaction is hugely important. People are more on social media now, which has its pluses and minuses. So we need to think overall how we're going to educate the next generation, across the world, and what kind of mental, health aspects the pandemic has caused, in these children, because the children are our future. The children are helping make, advancements, in science. And I think the final thing that I think everyone knows and realizes during this pandemic is that, we're here together. We're all going through this together. And we have to talk and communicate with one another because life is precious. And, it can be taken from you within a day's time. So you can be talking to someone and then tomorrow they're not here. And we have to value all the time that we have on this earth with our family and friends, because because it can be,
tomorrow is not given,
exactly. Tomorrow is not given, it's not promised. So
no, that's beautiful. That's a beautiful way to end this interview. And I wish we could talk for, I mean, I have more questions, but that's where it has to end, right? Like, as I said,
exactly.
I believe in this because I'm a spiritual person. So the philosophy that I believe in always says, I know whatever I started will end, whether it is this moment, or whether it's life, or whether it's sorrow, or it's happiness. So when you think that whatever I started will end, it also gives you a lot of, it calms you down, because if you're in a tough space, and okay, it can't last long because it has to end. So that's how I always look at situations, whether it's a good situation or a bad situation.
Exactly. Yeah.
In this case, it's a very good situation, but unfortunately, it has to. Thank you so much, Doctor. I'm thoroughly. I feel blessed to have had this conversation with you, and to have learned so much about, not only about what your experiences, but just about how calm you are, even after, I'm sure you've been probably working like straight 20 hours sometimes even 20 hours a day. And I'm complaining about my two kids. I was complaining about my two kids before this conversation, so I don't feel good now. But
no, one of the hardest jobs in this world is being a mother. So, and being able to do everything and all the wonderful things that you're doing.
But seriously, thank you so much, and I hope that we can meet someday soon. Hopefully, you can come here to this part of the world.
I would love that. Yeah.
Amsterdam, and I'd love to have you here, and we'll stay in touch.
For sure. For sure.
Bye.
Bye.